You're listening to Vet Synapse, a podcast connecting the world of research, innovation, and practical help to the veterinary profession. I'm your host, Dr. Philip Judge from Vet Education. Let's get connected with Vet Synapse. Welcome everybody to another episode of Vet Synapse. Today we're going to be talking about critical care nutrition or nutrition of the inpatients in your veterinary hospitals. And I could think of no one better to have a chat with about this topic than our speaker or our guest today, Cara Burns. Cara Burns is an absolutely amazing veterinary technician. She was actually the first veterinary technician specialist in veterinary nutrition, and she was the founder and first president, I think, of the veterinary technician specialty in the US. Cara, it's lovely to have you with us today on Vet Synapse. Thank you so much for joining us. And I'm just wondering if you would be able to fill out your bio a little bit for us and tell people a little bit about where you've come from and your amazing journey.
Absolutely. Well, thank you for having me. First and foremost, I'm thrilled to be here to, I'm always up for talking nutrition. So I so appreciate you having me on. Yes, I am a licensed veterinary technician, and as you mentioned, a vet tech specialist in nutrition. I started though in human medicine. I have a master's in physiology and a master's in counseling psychology, and I actually started as an emergency psychologist many years ago. And then I smartened up and went into veterinary medicine, which is where I probably should have been from the beginning, because I love it so much. And for me, nutrition just really was my passion from the very beginning. From when I was a vet assistant to when I became a licensed veterinary technician, I could see the benefit of both healthy pets and ill pets that they receive from proper nutrition. So from there, I've done a number of different things in the profession. I've been on and still are on a number of boards, and currently the president of the Pet Nutrition Alliance, and just always, as anyone who's ever heard me, I'm just always thrilled to be able to talk about nutrition, because it is the cornerstone to good medicine.
And there's so much research out there that backs that up as well. So
Yes.
We're absolutely thrilled. And now for anyone listening, I'm sure that you now appreciate why I said I couldn't think of anyone better to talk about this really important subject. Cara, I'm going to ask you a big question to kick things off, but it's a really important one, because we all know how difficult it can be to feed a patient with severe gastrointestinal illness such as parvovirus enteritis, and due to vomiting, the lethargy, the pain and discomfort and other symptoms that these patients have. What tips do you have, or what techniques have you found really work that may help both clinicians, veterinarians, as well as veterinary nurses and technicians, who are often the ones on the front line looking after these patients, be able to provide really good nutritional support to these patients?
That is an awesome question. And it is a big one. You're absolutely right. And I'm a proponent of, no matter whether they have parvovirus, pancreatitis, as long as we have the antiemetics that we have today, and we can, implement those, or the veterinarians can implement those upon admission, then we should be feeding these guys right away. I mean, historically, back when I first started in veterinary medicine, we weren't feeding pets right away. We were waiting really until they went home, and then we might start talking about nutrition. So it is so important to get nutrition on board quickly and early. And really, there's a big difference between, simple starvation and stress starvation, because with stress starvation, so in disease that we just mentioned, parvovirus, pancreatitis, the inflammatory response triggers alterations in cytokines and hormone concentrations and shifts the metabolism towards a catabolic state. at the onset of disease.
Mm.
And so with a lack of food intake, the predominant energy source is derived from that accelerated breakdown of endogenous protein. So basically, our sick patients are using their own muscle mass, their own energy to feed themselves. And so we need to get nutrition into these guys, as I've mentioned, right away, because of if we're not getting adequate nutrition into our patients, then we'll see impaired immune function, impaired tissue synthesis, impaired tissue repair. So, get antiemetics on board. And I'm a proponent of feeding tubes. Let's get a feeding tube into these guys as soon as possible. An NG tube or an NE tube, we, depending on what country, what state in the country, veterinary technicians, veterinary nurses typically can place those. But even if, one state doesn't allow it, veterinarian can do it, doesn't take much time at all. And then the technician can take over from there, or the nurse, and just, truly manage that case and make sure we're getting nutrients into the patient.
Absolutely. Because as you said, I mean, these patients start to begin to suffer from that protein calorie malnutrition almost from day one of their disease. By the time we see a patient with parvovirus, they're already sick for usually several hours beforehand. And as you said, they've got this heightened sympathetic and adrenal gland stimulation. They have they're in a catabolic state when they present. Right. And if we fast those patients, while it might reduce the volume of diarrhea, and the classic reasoning for fasting was that it decreased the amount of secretions and slowed down the amount of fluid loss in the patient and all of those things, and patients vomited less sometimes because they had less stuff in their stomach, but it really doesn't do the patient any good. So and the second thing I just wanted to catch on what you mentioned was that in those jurisdictions in which veterinary technicians or nurses may not be able to place the nasogastric tubes or nasal-esophageal tubes themselves, there's nothing quite, speaking as a veterinarian, nothing quite as obvious that I need to do something if the veterinary nurse or technician has the NG tube and the local anesthetic and the suture material laid out on the table next to the patient when I walk into the treatment room and say, hey, Phil, you have to do this. You got to put a tube in this dog because it's not doing that well. So there's lots of quiet diplomacy that could be carried out in the background there as well.
Yes, absolutely. And we should be doing that. We should have it all set to go, especially those of us who are focused in nutrition. We should have it all set for you as the veterinarian to just, put that tube in, and then we take over from there.
Absolutely. Are there any specific components? This is switching focus to diet as a little bit, because a lot of people I know are concerned about high-fat diets that are in some recovery foods. And we know that high-fat diets delay gastric emptying. If you eat a really fatty meal, then your stomach feels fuller for longer, and sometimes you don't feel that great. Is that something we're really concerned about in these early diets? Should we be feeding hydrolyzed diets or elemental diets first up in these patients that have got really severe GI inflammation?
Yeah, thank you. That's another great question. And what my approach is, what I think we should be doing, and what I have been doing for my critical clients and patients are semi-elemental diet. To my knowledge, there aren't any veterinary elemental diets. They're semi-elemental. Mm-hmm. And I have found those to be so incredibly beneficial and advantageous to our patients. You mentioned diarrhea, and a small amount of fiber, but the proper amounts of fat and protein, we can knock that issue out. And so to my veterinary nurses and veterinary technician colleagues out there, we're the ones typically that are, monitoring the patients. And if we don't want to deal with diarrhea, let's consider a semi-elemental diet with a little bit of fiber. Typically, the semi-elemental diets are high energy, so energy dense, so we don't have to feed a lot and we're feeding less. And then if we look at the different nutrients that are in there and we think of a critical patient, then we're looking at, yes, protein, fats, and carbs, but we're looking at the building blocks for those. So they're not whole proteins, they're not whole carbs, they're not whole fats. They're the building blocks. So the GI tract then doesn't have to work to break that down. They're already broken down. So that energy then can go to healing the disease condition or the disease state that the pet is in.
Excellent. Yeah, and those, you're right. Those, when you say semi-elemental, that's sort of similar to hydrolyzed diets. So some people might get hydrolyzed, and sort of the larger, more complex molecules have been partially broken down, so they're smaller. But
that's right.
Necessarily the individual amino acids. They're sort of small proteins and small
right
acids and so on.
Yeah, thank you for that clarification. Yes, that you're absolutely correct. They are hydrolyzed. They're again, I've heard it called hydrolyzed. I've also heard it called pre-digested because of, again, it's broken down to the point where it's readily digestible and easily absorbed. Yeah. And so, that's a definite plus for the GI tract of a critical patient.
Excellent. I want to just talk a little bit about things related to nasogastric tubes, because oftentimes they're those first tubes that are placed in a patient requiring nutritional support, not only for gastrointestinal disease, but also a lot of other illnesses as well, like trauma, for example, major system trauma, or post-operatively in a patient that's had end-to-end anastomosis, or may be recovering from a major surgery. Are there any you mentioned a couple of formulations that you have that you kind of like, and what formulations do you find work best through nasogastric tubes? Because I know some of the traditional diets that we are used to feeding, they can fairly reliably block nasogastric tubes in my experience. Blenderized canned foods and things, we run them through filters. They oftentimes get really dilute when we're trying to make them liquid enough to get down these tubes without causing a problem. And so I think that diets that are formulated to flow really nicely through these tubes have a huge advantage because they help our patients out. We've gone to the trouble of getting a tube in. How do we make the best use of those tubes with the diets?
Yeah, again, thank you for the question. Yes, you can take some of the different recovery formulations that are out there from different product manufacturers. And the majority of them, as you mentioned, do not go through a tube. You do have to dilute. And that's, I had just mentioned energy density. So if we're adding water, then we're diluting that energy, and we'll have to feed even more at a time, where we've already established that the GI tract really can't handle that. Again, nothing against any of those diets. The ones I'm thinking of are, they're more whole nutrients, as we talked about. So I like Emerade Intensive Care because, again, it is semi-elemental. And it's also, if mixed according to the directions, and I've mixed a lot of it, it can go through a tube. It can go through a feeding tube. It's meant to go through a tube, but this is the one that I was mentioning before that has slightly, I hate to mention that it's a little bit higher in fiber, because that sounds like, oh, diarrhea. No, it's got a very small amount of fiber that helps the GI tract to have proper motility, so we as veterinary technicians are not running into a ton of diarrhea.
Mhm.
So that's one of many advantages. But yeah, so I like the Emerade Intensive Care, and they also have a recovery formula. But for what we're talking about right now, I'm really focused on Emerade Intensive Care.
Yeah.
It is the other good thing about this that's different than some of the other recovery products is that they're species specific. So we're feeding, a canine formulation and a
Mm.
feline, a feline formulation. Whereas, many products that are out there are formulated for both cats and dogs. So I'm a huge proponent. If we have a veterinary product, let's use that. And if we have a veterinary product that is species specific, let's use that.
Great. That's really, really helpful. And I think I totally know what you mean, because things like thiamine and taurine and those sorts of things that, if a diet's made for dogs and cats, all of those things are perhaps in higher concentrations than maybe what the dog needs. And they
Right.
have got quite different nutritional requirements in terms of specifically protein concentration,
Right.
their recovery
Right.
as well, don't they? So that makes a
Yes.
huge difference to have those species specific options available for animals.
Yeah. Yeah.
When it comes to feeding, let's say we have a parvovirus patient, because I choose parvovirus because it's a really common disease, certainly in our part of the world, and we're just coming up to our rainy season here, so it'll become a lot more common and over the summer months. But parvovirus enteritis patient, it's vomiting, maybe 20, 30 times a day. And we have this patient in, maybe we have a nasogastric tube in, and to perhaps allow for some short-term suctioning of gastric contents to minimize that residual gastric volume they have. And then we may be starting to feed them. Are we feeding them their entire resting energy requirements within a couple of days, or do we worry necessarily about always having to get to resting energy requirement feeding in the parvovirus puppy? Or is it some nutrition better than none, even if the patient's clinical status means we're always trying to catch up in terms of the amount of food we're feeding them just because they're not tolerating it?
Yeah. I certainly think some is better than none.
Mm-hmm.
I think we want to try to get to RER, as much as possible. But again, the first day that we get the tube in, we're not aiming for RER that day. We want to gradually, reintroduce food or nutrients to these parvo patients. So we want to do it gradually. Even if we get, a third of the RER in on the first day, we're doing right by that pet. Mm-hmm. So, and typically over the course of 3 days, if we're up to RER, wonderful. If not, it's okay. I don't want people to, or, my colleagues to think, oh, I have to get to RER. We have to, see how the patient is responding,
yeah.
Most importantly, and do a gradual increase until they are comfortable with the amount of energy that they're getting. Mm-hmm. So yeah, I'm a big proponent of, yes, let's get nutrition into them, but let's do it safely and let's do it in a way that the patient responds positively. We don't want to cause more issues for that poor parvo puppy.
No, that's right. And I guess that's the point I was trying to get at, is that it's really important to get nutrition into the patient. Yeah. But I do know that sometimes it can be a little stressful if we haven't reached that magic RER, which is great if we get there, but sometimes let's not use the failure to get RER as a disincentive for that nutritional support. It's better for them to have something rather than nothing. In fact, I think there was some research in experimental research that even showed that some intestinal distension with fluid, even sodium chloride, believe it or not, actually increased the amount of collagen synthesis in bowel that had been recently anastomosed in surgery. So it was really just even just distension with something helps.
Yes.
So
yes.
The important thing is to start early and work your way up to that goal, but not necessarily to be too upset if you're not able to get there if the patient's not tolerating it.
Exactly. Yep.
Tell me, your thoughts on bolus feeding versus intermittent feeding when you've got a nasogastric or nasaloesophageal tube down?
I'm and maybe, maybe I'm just old school, but I want to monitor the patient. I want to do my vitals. I'm going to be there looking at the patient and making sure that while I'm doing vitals, I'm also able to do a bolus feed, because the GI tract is so much better prepared, if that's the right way to say it, for small amounts, or it's more advantageous for small amounts of nutrition periodically throughout the day. So we can do these small boluses. It's better for the patient's GI tract when we go to do our monitoring. So yes. I'm going to switch focus now to nutritional elements. Now, we've spoken a little bit about proteins and fats and carbohydrates and so on. Patients with pancreatitis, do you have, we have good nutritional recovery or intensive care formulations. Are they suitable for patients with pancreatitis, or do we need to use food that's lower in fat for those patients? Because I know traditionally, we've been taught high fat's bad for pancreatitis, right, for want of more research in the area, obviously, to confirm that. But that is certainly something that's out there in the veterinary community. We should stay away from diets that are too high in fat. How critical is that in particularly those early days when we may well be feeding less than the RER for those patients when we're starting to feed them? That is a great question. And for me, it's going to depend on what we're feeding. Because of, yes, some of the recovery diets are very high in fat, and to me, then we're just creating almost like a never-ending loop of disease. But there are some products that, and again, if it's an elemental or semi-elemental, and those fats are broken down to the building blocks, I am not seeing pancreatitis worsen with patients on those diets. And actually, I did speak with a number of different criticalists in the U.S. that were feeding that intensive care diet, and they also had great success with getting the semi-elemental foods into those pancreatitis patients, even if, the fat level, if you read the bags, which there's a whole nother podcast. But, we can't always go by that because of the quality of the proteins, the quality of the fats, and the carbohydrates. So, and really how they are added into the food. So if we have those building blocks, then we're not going to, or at least the products that I have been using and that I have talked to some of my colleagues about, we're not seeing issues feeding a higher, percentage of fat to pancreatitis patients.
Thank you so much for that answer. I'm going to switch tack. What about respiratory disease? Certainly in the human field, for patients with respiratory disease, they're feeding very high-fat diets, including diets such as Pulmocare, which is greater than 50% fat content, in order to reduce stress on the respiratory system. What do we know about these sorts of diets in dogs and cats?
I have been looking into it. I haven't found a lot of information or research specifically in cats and dogs. So if you have some, please send it my way. What I found were some studies in animal models, but they were looking at that for SARS patients, human SARS patients. But, the thought process was very intriguing for me. And one of them is, animal models of, sepsis-induced acute respiratory distress syndrome have shown that a low-carb, high-fat diet combining the anti-inflammatory and vasodilatory properties of eicosapentaenoic acid, so an omega-3 fatty acid, gamma-linolenic acid, and antioxidants improves lung microvascular permeability, oxygenation, and cardiopulmonary function, and reduces pro-inflammatory eicosanoid synthesis and lung inflammation. So as I was looking through this study, I can absolutely see why you were intrigued, because now I'm intrigued because it has to, maybe not 100%, but it has to translate into our veterinary patients. So I'm going to definitely be looking more into this because and I want to come back and and answer your question once I can find some, or maybe someone out there will want to do this research and I can help them.
Absolutely. Well, we're always told that we are what we eat, and so the quality of the fats
That's right.
is going to translate into the sort of inflammatory mediators that get liberated. Yep. Cells when they get damaged, and ideally perhaps maybe we should all be eating eicosapentaenoic acid enriched diets well before we suffer from or anything right. Like that. And I know that's very topical now with SARS-CoV-2 being such a major thing, but it's It is really fascinating. I don't think we're at the bottom of where we need to be as far as our knowledge of nutrition in these various disease states is concerned. But I really appreciate your answer. And to go back to answer your previous question, I don't have any research. I don't think there is known research specifically in dogs and cats on this. It's just that it was something that sprang out of looking at the sorts of diets that are applied to human beings in the critical care unit. And certainly if you're human with respiratory disease, they'll have you on Pulmocare or something similar to that, which is very, very high fat content. Finally, I just want to touch on cats. Now, you've spoken about Emerade having feline-specific formulation, which is fantastic. For people that may not have access to feline-specific formulations of diets, what should we be feeding them down a nasogastric tube? Let's sort of go with that, because they're relatively easy to place in cats that are, really unwell in the first sort of 1 to 2 days of hospitalization, where they may not tolerate an anesthetic to place an esophagostomy tube. But what sort of diets should we be feeding critically ill cats, down a nasogastric tube for starters? And then secondly, once we're transitioning them onto maybe esophagostomy or maybe oral intake, what's the best sort of food to be feeding them during recovery from critical illness?
Yeah, thank you. As I mentioned earlier, Emerade Intensive Care does come in, a feline formula, and the recovery formula is called Emerade Sustain. It has a few more whole ingredients than the intensive care. So the theory behind that is we're rebuilding, we're transforming the GI tract from, going from semi-elemental to a few more whole ingredients and then transitioning back to their food. So again, I like the Emerade Intensive Care for our critical patients. We have, it's again semi-elemental, so it's pre-digested. The nutrients are broken down, and we can again mix it to get it through a tube as small as a 5 French. Mm-hmm. So for me, this is again the diet that I have been using, and I know that Emerade, the Lefebvre company, is expanding production, and it is available in many parts of the world. So hopefully people will try it, or if they have a question, they can reach out to Emerade. I am a proponent, as you know, of bolus feeding, so we can do that. Mm-hmm. Has essential amino acids. specifically for felines, has a hydrolyzed soy protein, which is going to minimize GI sensitivity. Again, we haven't seen, or I haven't seen, and when I say we, I am referring to my colleagues that I talk to make sure what I'm seeing is what others are seeing.
Sure.
Haven't seen any of the diarrhea, which is a wonderful thing. And I mean, really, dietary nucleotides that provide RNA and DNA precursors, they're in there to help support the immune system, again, nourish that GI tract and assist in weight gain, which, especially in cats, is extremely important in critical disease conditions. So, I'm just, I'm a huge proponent of the Emerade. Also, we touched on it, when we were talking about icosapentaenoic acid, but both formulas, cat and dog, have omega-3 fatty acids. And again, I love omega-3 fatty acids for their anti-inflammatory properties, and they also help to modulate the inflammatory response and aid in tissue synthesis. So I could go on, and I'm happy to do that, but it's absolutely, has worked for me. And when I am, working with my critical cats and dogs.
Brilliant. That's great. And just a question, obviously, when we've spoken about transitioning a patient from no nutrition, perhaps when they present to us, to over sort of 3 or 4 days, getting them up to as close to RER as we can, during those first 2 or 3 days, clearly the amounts of essential amino acids and vitamins, things like thiamine, for example, in cats particular, are not being fed at optimum levels to those patients. Is this something that we should be supplementing to our patients for the first 2 or 3 days, particularly thiamine supplementation to cats?
It's a great question, and I think we have to be monitoring it. Because and it also depends on how long it has been since, the vomiting and diarrhea has started to when they brought the pet in. Obviously, the longer, then the more apt we're going to have to supplement thiamine. We also have to keep an eye on cobalamin and some of the other vitamins that are out there. So for me, I'm going to monitor, obviously, on the veterinarian's orders, but that's, for me, why I think it's so important to do an in-depth nutritional history. Mm-hmm. Oftentimes we'll get the call, oh, my cat's been vomiting just today, but then, when they come in and we're doing a history and using our open-ended questions, we find out it's been probably at least a couple of days, if not more. Mm. And with cats, if it's more, then we have a lot of things to worry about. Hepatic lipidosis is one. Yeah. So again, I implore all of my colleagues out there to do, I understand these are emergency cases, but we still have to do an in-depth nutritional history to help get that patient back quicker and feeling better, and then discharge sooner. So for me, it's going to depend on thiamine levels, but also we can get a pretty good idea from a really in-depth nutritional history.
Yeah, and you're right. A lot of times these patients present and the stress level is high on the part of the veterinary team looking after the patient if it's critically ill or it's an emergency patient, and they're quite high on the part of the client as well. So sometimes these nutritional histories can be something that can be telephoned in later on once the patient's stabilized, for somebody to get on the phone with the client to say, hey, I'm just wanting to fill in a few blanks that we have, and to actually conduct that history when the client's had a chance to settle down, and when you can give them an update on the emergency status of their pet, and they may be able to think a little more clearly and reflect
Yes.
a bit more accurately on what's going, what their pet has been doing. And they can say, well, when did he last eat normally? Well, that may be a week ago or more.
Right.
A foreign body that's inching its way down the GI tract or something.
Right.
So,
right.
So that's really, really important. Cara, I'd really like to thank you tremendously for sharing your time with us today and for also sharing your considerable knowledge on those things. We'd love to do another podcast. I think nutrition is one of those fields in which there are so many different tentacles and little avenues and alleyways we can dive down into to talk about things in as much or as little detail as anyone cares to listen to. So I would love to have you back for another podcast at some stage. But thank you so much for taking time out of your extremely hectic schedule to share your knowledge with us today. Do stay safe in amongst all of the global pandemic that we're in, and keep eating icosapentaenoic acid and many other great things.
That's right. Well, thank you so much. I'm honored to be on your podcast, and I'd love to come back. But thank you for this and for the discussion. It's crucial for our patients. So I appreciate you taking the time and allowing me to talk about nutrition for critical patients.
Oh, it's absolutely our pleasure. Thank you so much again. Thank you for listening to this episode of Vet Synapse. If you like this episode, please subscribe to the podcast and share it with your friends and colleagues. Make sure to visit our website at veteducation.com.au for more great content and to experience the latest online race-approved veterinary continuing education.